Welcome back, everyone. I'm going to try to make the introduction as quickly as possible because there is a lot to unpack here. I came across so much information, I'm not even able to squeeze it all into this video. Remember the last video that I made? The point of that was try and draw attention to the power dynamic that the insurance companies, the health insurance company institutions are using a dictatorship sort of power dynamic with our health care. You have unlicensed, unregistered people that don't even practice healthcare, people that are little more or nothing more than insurance agents dictating how healthcare is provided. There are other companies that are engaging in unequal power dynamics, but I will save that for later. Right now, let's focus on the medical side. And remember what I told you about insurance companies trying to save money instead of doing what's best for the patient. Through this, I will go over Gabapentin and Cymbalta as alternative means of pain management to opioids and opiates. Ultimately, the goal here is to hammer home that the opiate epidemic is based off of fear, paranoia, and hype that has been perpetuated by propaganda. Ultimately, I think the insurance companies and Big Pharma, which we all know about Big Pharma, wants you to go on gabapentin and Cymbalta and cyclic antidepressants instead of opiate and opioid medications, because opiate and opioid medications are far less expensive. Without insurance, an opiate or opioid medication without insurance could be between $5 to $10. Cymbalta and gabapentin without insurance could be between $1,000 to $300 a bottle. So I'm really trying to hammer home here the sick, disgusting deploracy that is the opiate epidemic and the struggles and turmoils and strife that it is producing and trying to help people with pain management treatment. So here I bring to you, let's go over Cymbalta. Let's do Cymbalta first, the side effects and the withdrawals of Cymbalta. Here's another lovely little drug that is commonly prescribed to as an alternative to opiates for pain, Cymbalta. Originally, this drug was made and produced. It's an Ssri antidepressant. And if you know anything about antidepressants and SSRIs, you have to know that they can cause extreme fits of mania. This is true. But Cymbalta is a very interesting drug. And, it's a good thing that we're prescribing drugs like Cymbalta instead of opioids or opiates. And we're going to find out why. So here's the side effects from WebMd of Cymbalta. See also warning section, it says. Nausea, dry mouth, constipation, loss of appetite, tiredness, drowsiness, or increased sweating may occur. If any of these side effects persist or worsen, tell your doctor promptly. Dizziness or lightheadedness may occur, especially when you first start or increase your dose of this drug. To reduce the risk of dizziness, lightheadedness, or falling, get up slowly when rising from sitting or laying position. You've got to be kidding me. You think this is acceptable? Okay. Remember that your doctor has prescribed this medication because he or she has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. This medication may raise your blood pressure. Check your blood pressure regularly and tell your doctor if the results are high. Tell your doctor right away if any of these serious side effects occur. Confusion, easy bruising/bleeding, decreased interest in sex, changes in sexual ability, muscle cramps, weakness, shaking, tremors, difficulty urinating, signs of liver problems such as stomach or abdominal pain, persistent nausea, vomiting, yellow eyes/skin, dark urine. Get medical help right away if you have any very serious side effects, including black or bloody stools, vomit that looks like coffee grounds. Oh my God. Seizure, eye pain, swelling, redness, widened pupils, vision changes, such as seeing rainbows around lights at night, blurred vision. This medication may increase serotonin and rarely cause a very serious condition called serotonin syndrome toxicity. The risk increases if you are also taking other drugs that increase serotonin. So tell your doctor or pharmacist of all the drugs you take. See drug interaction section. Get medical help right away if you develop some of the following symptoms: fast heartbeat, hallucinations, loss of coordination, severe dizziness, severe nausea, vomiting, diarrhea, twitching muscles, unexplained fever, unusual agitation, restlessness. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice the symptoms of a serious allergic reaction, including rash, itching, swelling, especially of the face, tongue, throat, severe dizziness, trouble breathing, skin blisters, mouth sores. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. It says see warnings section. Precautions. Allergic reaction. Oh, more weird side effects. Before using medication, tell your pharmacist or medical, tell your doctor or pharmacist your medical history, especially of personal or family history of psychiatric disorders such as bipolar, manic depressive disorder, personal or family history of suicide attempts, bleeding problems, personal or family history of glaucoma, high blood pressure, kidney disease, liver disease, seizure disorder, stomach problems such as slow emptying of the stomach, alcohol abuse. This drug may make you dizzy, drowsy. Alcohol or marijuana, cannabis can make you more dizzy or drowsy. Do not drive, use machinery, or do anything that needs alertness until you can do it safely. Avoid alcoholic beverages. Talk to your doctor if you are using marijuana, cannabis. If you have diabetes, this is the chemical name for Cymbalta, may affect your blood sugar. Check your blood sugar regularly. Oh my God. Older adults may be more sensitive to the side effects of this drug, especially bleeding, dizziness, lightheadedness, or loss of coordination. Older adults may also be more likely to develop a type of salt imbalance, especially if they are taking water pills. Dizziness, lightheadedness, loss of coordination can increase risk of falling. Children may be more sensitive to the side effects of this drug, especially loss of appetite and weight loss. Monitor your weight and height in children who are taking this drug. See also warnings. Oh my God. So where's the warning section? I don't see the warning section. Oh, okay. Yeah. I'm glad that we're, giving Cymbalta, an SSRI, a drug that was developed as an antidepressant and probably not something you're supposed to be on long-term for pain management therapy instead of opiates, right? Because, there's hardly any side effects to this. I'm being facetious, of course. That's a ton of side effects. And just for the sake of intellectual honesty and prosperity, we are going to, use other citations. This is from the mayoclinic.org. Pretty substantial, pretty good citation here. I wanted to show this because I've not seen this before in my research with Cymbalta. This is a list of drug interactions. This is a lot of different drugs that have negative reactions with Cymbalta. Aspirin is on this, okay? There's several benzodiazepines, and there's a non-narcotic version of an anti-anxiety, anti-panic attack medication. Buceprone is on here. That is a non-narcotic anti-anxiety medication. So look at all of these drug. Clonazepam. They even mention cocaine. You might as well say if you're on any kind of drug at this point, there could be a problem in taking Cymbalta. Tobacco is another interaction. Precautions. It is important that your doctor check the progress at regular visits to allow for changes in your dose to help prevent any unwanted effects. Do not take Cymbalta if you have taken an MAOI inhibitor. And then it lists a bunch of MAOI inhibitors. Cymbalta may cause some teenagers and young adults to be agitated, irritable, or display other abnormal behaviors. It may also cause some people to have suicidal thoughts and tendencies or to become depressed. Some people may have trouble sleeping, get upset easily, have a big increase in energy, basically mania, hypermania, or start to act reckless. Yeah, that's hypermania. That's psychosis. If you or your caregiver notice any of these unwanted effects, tell your doctor right away and let the doctor know if you or anyone in your family has bipolar disorder, manic depressive, or has tried to commit suicide. This medicine can cause serious liver problems. If you experience symptoms such as dark urine, general tiredness and weakness, light-colored stools, nausea and vomiting, upper right stomach pain, or yellow eyes and skin, contact your doctor right away. Make sure your doctor knows about all other medications you are using. Cymbalta may cause serious conditions called serotonin syndrome or neuroleptic malignant syndrome. Like reactions if taken with certain medications such as buceprone. Remember, buceprone is a non-narcotic. Fentanyl. Oh, fentanyl is just dangerous. Lithium. Lithium's pretty dangerous too. Tryptophan. Okay, this is St. John's wort. St. John's wort is pretty freaking mild. That's crazy. Okay. This medicine may increase your risk of bleeding problems. Let's get on to the side effects because it's really what we're after. So, I mean, you're aware of this stuff. I will leave the links. So let's get on to the side effects. Along with it, its needed effects, A medicine may cause some unwanted effects, although not all these side effects may occur. If they do occur, they may need medical attention. They may need medical attention. Check with your doctor immediately if any of the following side effects occur. Abdominal or stomach pain, area rash, blindness, blistering, peeling, or loosening of the skin, blurred vision, changes in consciousness. Change in consciousness. Chills, clay-colored stools, cold sweats, confusion, convulsions, dark urine, decreased urine output, decreased vision, difficulty with swallowing, dizziness, faintness, lightheadedness when getting up suddenly from laying or sitting position, eye pain, fainting, fast or irregular heartbeat, general tiredness or weakness, hives or welts, itching or skin rash, hives, itching, puffiness, swelling of the eyelids or around the eyes, face, lips, or tongue, increased thirst, joint or muscle pain, large hive-like swelling on face, eyelids, lips, tongues, throats, hands, legs, feet, or sex organs, light-colored stools, loss of consciousness, red skin lesions, often with purple center, red irritated eyes, redness of skin, sores, ulcers, or white spots in mouth or on the lips, swelling of the face, ankles, or hands, tearing, tightness in the chest, unpleasant breath odor, upper right stomach pain, vomiting of blood, yellow eyes and skin. Get emergency help immediately if any of the following symptoms of overdose occur: agitation, diarrhea, fever, loss of bladder control, muscle spasm, or jerking of all extremities. And I can tell you from personal experience, I have taken this medication. I have experienced muscle spasms or jerking of all extremities, and that's without overdose. That's just with a regular milligram, like one pill. Overactive reflexes, I experienced that one too. Poor coordination, that one too. Restlessness, that one too. Shivering, that one too. Sleeplessness or unusual drowsiness, that one too. Sudden loss of consciousness, sweating, talking or acting with excitement you cannot control. I've experienced that one too. Trembling or shaking, I've experienced that one too. Twitching, that one too. Unusual tiredness or weakness, vomiting. More common side effects: body aches or pain, cough, difficulty having a bowel movement, dry mouth, ear congestion, frequent urination, headache, lack or loss of strength, loss of appetite, loss of voice, muscle aches, nausea, sleepiness or unusual drowsiness, sneezing, sore throat, stuffy or runny nose, sweating, increased trouble sleeping, weight loss, abnormal orgasm, acid or sour stomach, belching. These are less common. Burning, crawling, itchy, numbness, prickling, pins and needles, or tingling feelings. Change in taste, change or problem with discharge of semen, decreased interest in sexual intercourse, difficulty with moving, feeling warmth or redness in the face, neck, arms, or occasionally upper chest, heartburn, inability to have or keep an erection, indigestion, longer than usual time to ejaculate, ejaculation of semen, loose stools, loss of sexual ability, desire, drive, or performance, loss of taste, muscle cramps, pains, or stiffness, shakiness in the legs, arms, hands, or feet, stomach discomfort or upset, sudden sweating, swollen joints, trembling or shaking of hands and feet. Oh my God. That's a mouthful. So yeah, good thing Cymbalta is being prescribed to, 80-year-old women and children and, just elderly people in general for pain management instead of opiates, right? Because opiates are extremely dangerous and addictive. And good thing Cymbalta, while it has all these crazy side effects, at least it's not addictive, right? Is Cymbalta addictive? All right, so this is from drugwatch.com, and it's about the side effects of Cymbalta. And this one has some
or withdrawal symptoms of Cymbalta. This one has some side effects, though, that were not listed previously. Brain zaps, that's one that you should keep in mind. Electrical shock sensations, that's another one you should keep in mind. But this one had something that I found in rare cases, patients have suffered serious and sometimes fatal side effects, including liver damage, abnormal bleeding, and suicidal thoughts and behaviors. So, common side effects. We already went over side effects. I'm more interested in the withdrawal symptoms of gabapentin. It says brain zaps and other withdrawal symptoms. Quitting Cymbalta abruptly may bring on severe withdrawal symptoms that can last for weeks or even months. To avoid such symptoms, the drug's manufacturer recommends gradually reducing dosage when stopping the drug. A 2005 analysis of clinical trial data by researchers at the Lilly Research Center found that 44.3% of patients who quit using Cymbalta experience withdrawal symptoms versus 22.9% in the placebo group. Symptoms, that's a pretty big ratio, 44.3 versus 22.9, okay. Symptoms of this phenomenon, such as Cymbalta discontinuation syndrome, include severe nausea, dizziness, and electric shock-like sensations in the head called brain zaps or brain shivers. Some patients report symptoms become so sick they were unable to go to work, and some need to be treated in the hospital. Yeah, good thing we're prescribing this to, elderly women and children for pain management therapy instead of opiates, right? Because it's such a safe drug because it's not an opiate. It's no way addictive, even though I'm reading you the literal symptoms of withdrawals. Other reported Cymbalta withdrawal symptoms include nightmares, headache, fatigue, vomiting, insomnia, anxiety, vertigo, irritability, tingling or prickling sensations in the skin. This drug is another drug that messes with the neuropeptides in your brain. And this is why it produces this tingling, prickling sensation in the skin, as well as what is known as brain zaps. Withdrawal symptoms appear to be more common with Cymbalta than with other antidepressants. An analysis by the Institute for Safe Medication Practices described 888 reports of withdrawal events for Cymbalta in 2016. That was the largest number for any antidepressant affecting serotonin receptors. The study noted that drugs with a short half-life, the time it takes for the body to eliminate half of a dose of the drug, generated more frequent and severe side effects. Cymbalta has a very short half-life of about 12 hours. Clinical discontinuation studies of antidepressants with shorter half-lives showed 46 to 78% of patients experienced 2 or more symptoms, according to the analysis. Gradually tapering recommended. Okay. Yeah, good. Think twice before stopping your drug cold turkey. Let's listen to this PhD talk about explaining withdrawal symptoms associated with antidepressants.
One of the big issues with taking antidepressants are the potential withdrawal symptoms that can happen when you reduce or abruptly stop taking medications. I'm going to be very clear right now that no one should ever abruptly stop taking any medication at all, and especially medications that are prescribed for psychological distress, including antidepressants and antipsychotics, because the body quickly gets acclimated to these drugs and in a sense depends on them for the level of functioning that they maintain. So going off of them abruptly is dangerous, and can cause death, and can cause irreparable damage, physiological damage.
Did he just say cause death? He just said causes death.
Besides even the emotional damage of suddenly flooding one's psyche with all of those emotions that have been trapped and buried under the medication.
Oh, yeah, I'm so glad we're prescribing this as a pain management treatment instead of, opiates. It's so safe. It's so safe. Just to let you know, SSRIs, cyclic antidepressants, mood stabilizers, and antipsychotics, second-generation tranquilizers, all of them are addictive. All of them have withdrawal symptoms. All of them have a list of side effects that go from one end of my house to the other. So, yeah, you heard it from a PhD, in my PhD. So. All right, so just for, intellectual honesty and prosperity, we're going to use other citations, but I found this to be interesting. This was just in this little thing here. It was a pop down. It says, how long do Cymbalta withdrawal symptoms last? According to research, side effects of Cymbalta withdrawal can appear hours or days after tapering off or stopping the drug. Most short-term withdrawal side effects can last for up to 6 weeks. Need I remind you, opiate withdrawals only last for 1 week at best. So it's a good thing that we're prescribing Cymbalta as an alternative to opiates because, opiates are so dangerous. Their withdrawal symptoms of opiates only last for 1 week, and it's opiate. It's dangerous because it's an opiate. I will get to opiates eventually, opiates, opioids. But right now we're gonna go to this one because it had a good list here. So what is this? Baum BH Hedlund Law. Cymbalta Withdrawal. So this is one of those medications that's probably got in bed with one of those class action lawsuits because of the amount of side effects that this particular drug has. And it goes into explaining also why it has the brain snaps and the shaking and the tremors and everything. So it's no, this one didn't. The other one did. So I'm gonna just go to that one. No, that's the wrong one. Sorry. This one really quick as it describes it. It has the medical terminology that I was looking for earlier. It's, it goes into explaining it's an SSRI. While SSRIs act only on serotonin, SSNRIs act both serotonin and norepinephrine neurotransmitters. So this is why this little cute word right here, neurotransmitter, is the reason why Cymbalta does what it does. Okay. So now we're going back to this one where it has these withdrawal symptoms. So common side effects of Cymbalta withdrawal: extreme mood swings, aggression, confusion, vertigo, headache and or migraines, excessive sweating, suicidal thoughts, self-mutilation, tremors, fatigue, flu-like symptoms, abdominal discomfort, weakness, etc. Brain zaps, electrical shock-like sensations in head, agitation and or irritability, nightmares and or sleep disturbance, diarrhea, dizziness and or lightheadedness, nausea and or vomiting, memory and concentration difficulties, suicide attempts, hallucination and or sensory disturbances, seizures, lethargy, body zaps, electrical shock-like sensations in body, not in head. So these withdrawal symptoms can start within 12 hours of stopping and can last up to 6 weeks. 6 freaking weeks. That's pretty intense. So, at least it's not an opiate though, right?
Now that we've gone over the side effects and withdrawal effects of Cymbalta, I'd like to show you a few diagrams or things, testimonies from patients themselves who have undergone treatment of Cymbalta, so you can hear it with your own eyes. Hear it with your own ears.
Chip, taken 1 to 6 months, posted March 17th, 2021. Started taking this for pain over a 4-month period with gradual increases up to 120 milligrams. It gave me severe depression and made me feel like I wasn't myself at all. I also had brain fog and almost 10 pounds weight gain, even though it got rid of my appetite. A lot of water retention, especially around my lower abdomen. It also gave me poor sleep and terrifying nightmares. Weaning me off now with a schedule from my doctor. I would not only not recommend this drug, but if it must be tried, to talk to your doctor weekly about your moods and feelings in case you start to feel depressed or worse. Adbub, or however you say that. Taken 1 to 6 months. Published August 29th, 2017. I suffer from chronic pain, depression, and anxiety for the past 10 years, and I'm 30. Football ruined my life, but Cymbalta has made it worse. Not only did I not receive any benefit from Cymbalta, but I gave it a serious 2-month try, and I'm not spending 90% of my time withdrawing from it. I cannot imagine if I was on this a year, let alone 10. If this medicine helps you, I would weigh the benefits seriously, because either you're going to the grave with this medication, or you're going to have to feel the benefits, quote-unquote benefits, of coming off this poison. Beware, because no doctor will tell you these things. Worse than 2 years of clonazepam, alcohol, or opiates. No joke. Hope this helps someone. Always in pain. Taken for 1 to 6 months. Published June 2nd, 2020. Cymbalta is somewhat costly. Initially prescribed for lower back pain. The first 2 to 3 months, it worked very well. It helped with back pain and improved my general mood. Bonus feature. It was helping with my permanent migraine. I had only a few side effects at first, but they started building up. Insomnia to the point of 15 minutes of sleep or less per day for over a month. Spontaneous ejaculation, cold sweats, no sex drive. Started to get a few electric shock-like sensations in the extremities. Started to feel zombie-like. I came off the stuff cold turkey. Withdrawal symptoms included many shock-like jolts to hands and feet for about 6 years. A few months of zombie-like feeling, low drive. I'd rate it good for a short-term use, 1 to 2 months. Anything longer than 3 months, I would strongly advise against, as any other antidepressant. Amira, taken for 6 months to 1 year, May 2nd of 2020. Cymbalta has been the worst drug I've ever been on and was irresponsibly prescribed by my doctor for chronic pain. I was on it for 4 months and it didn't work at all. To make it worse, I almost died from withdrawal because my doctor took off for 3 months and left no one in his place to write my prescription. Therefore, I went into withdrawal, which he never warned me about. This drug is worse than an opiate. If you take your medication responsibly, you shouldn't be denied other more helpful medications. Blue Sky, taken for less than 1 month. Published December 25th, 2020. One of the worst medications ever. First 5 days, had no desire to do anything. Complete apathy about everything. Also, had terrible nausea for 5 days. That finally went away. Then it started feeling like someone was literally tapping on my brain. It did nothing for the chronic pain I had. I don't know how anyone can take this medication. Stopped taking it. Had a headache for a few days. That was it. Izzle, taken for 1 to 2 years, posted December 4th, 2019. I gave it a 2 because it helped with my pain, and I saw a very quick change in my anxiety. But I've lost so much sleep over the last year due to insomnia and severe night sweats. My doctor told me take it in the morning instead, but since I needed help sleeping, this was already doing the opposite. If I miss a single dose, I get severe electric shocks, starting in my head, going to my feet, burning head but freezing extremities, shakes, nausea, and that's the physical symptoms. Mentally, I would be willing and almost hitting my head against a wall, begging whatever was going on to stop. I tried going off it cold turkey after a year on 60 milligrams, and the physical and mental pain is what I'd imagine heroin withdrawal to be. Now, my dosage is halved. My chronic pain is back with a vengeance. So it was working for my pain, but I feel pushing through the pain from the get-go would have been easier than going through the side effects of this medication for a year. Be warned, this drug is for life. Jules, taken for less than 1 month, published June 5th, 2020. For depression, I took a 30 milligram Cymbalta capsule at 9 a.m. and 9:30 a.m. It was like someone threw a brick at my head. Then I started to get brain zaps. I thought it would wear off, but I started to get cramps, became very thirsty, vomiting, became uncoordinated, and then called an ambulance. My sodium level dropped to 118, and I got hypotermia. They took me straight to emergency department and gave me a brain scan and a salty drink. I stayed in the emergency ward for 4 days, and they said never to have Cymbalta again or I could have a stroke or worse. I am a 58-year-old, healthy female. I would be very cautious taking this drug and definitely have someone with you who can take you to the hospital if things go wrong, as they did with me. I was lucky I still was thinking straight enough to call an ambulance that saved my life. Sandra posted less than a month ago, March 28th of 2021. I took my first dose around 8:30 p.m. last night, 30 milligrams. Went to sleep around 10:30 p.m. Woke at 2 a.m. with hallucination-type dreams. Felt like I would vomit. I went to the couch so I wouldn't wake my husband. I shivered, sweated, had diarrhea, and was in a dreamlike state but couldn't sleep. The nausea was the worst. Hard to keep even water down. Though the rest of the day, I had nausea hitting me hard. Could only make it to the bathroom. Finally called the doctor and asked for nausea medication, and that seems to help some. I'm never taking this again and wouldn't recommend it for someone new to antidepressants. I'm almost 24 hours from my first dose, and I'm feeling sick, but I can't eat. But I can eat a little now.
Now that we've gone over the first-hand accounts of people who have been prescribed this nasty medication, you saw first-hand experience. Now, let's go over the side effects and withdrawals of gabapentin. And I do want to stress as much as people fear opiate and opioid prescription management, that people think related even to death. Keep in mind, both of these medications have the capability of killing you not just in side effects, but in withdrawal and overdose as well. So here we go. Here's the side effects and withdrawals of gabapentin.
All right, this is gabapentin and its side effects, because, gabapentin isn't addictive. It's safe. It's not an opiate. It shouldn't have that many side effects, right? Gabapentin can cause side effects according to a 2017 review. These side effects were slightly more common in people taking gabapentin than a placebo. The most common side effects occurring in 10% of participants on gabapentin were dizziness, sleepiness, water retention, swelling of the arms, hands, legs, and feet, problems walking. Serious side effects were not common and were in the same in those taking the placebo. Children and older adults may be most susceptible to adverse reactions to gabapentin. Possible side effects include back or chest pain, constipation, diarrhea, vomiting, upset stomach, increased appetite and weight gain, blurry vision, bruising, changes in mood, chills, a cough, fatigue, a fever, flu or cold-like symptoms, hoarseness and dry mouth, memory loss, mouth ulcers, shortness of breath, a sore throat and swollen glands, trembling, urinary problems, weakness, uncontrollable eye rolling. In children, some of the more common adverse reactions are anxiety, depression, or other mood changes, behavioral problems, changes in performance at school, hyperactivity, lack of concentration. Individuals taking gabapentin should talk to their doctors about any side effects that occur, especially if they are severe, ongoing, or get worse. Seek emergency medical treatment if symptoms of a severe allergic reaction occur. These include breathing difficulties, extreme dizziness, fever, hives, rash, severe weakness, swelling of the face, lips, tongue, throat, yellowing of the skin. Yeah, real safe medication, huh? I want you to understand this medication was originally made as an anti-seizure medication, so it does some really weird stuff to the central nervous system. So the reason I was wanting to emphasize the trembling and the weakness, uncontrollable eye rolling, and the behavioral problems that come along with taking this medication. This medication is doing something really bad to you. Like I'm not going to use the word bad because that's bias. I'm going to say it's affecting you psychiatrically, and it's doing something to your central nervous system. And I believe I even read somewhere that this drug can cause blood clotting issues. That can be a pretty severe problem. Blood clotting can lead to other problems, like not a stroke. I mean, that is one of them, but I'm thinking of something else.
Aneurysm.
All right, just to be accurate, intellectually honest, and for prosperity's sake, here's another list of side effects from a different source. Side effects: drowsiness, dizziness, loss of coordination, tiredness, blurred, double vision, unusual eye movements or shaking, tremors may occur. If any of these side effects persist or worsen, tell your doctor or pharmacist promptly. Remember that your doctor has prescribed this medication because he or she has judged that the benefit to you is greater than the risk of the side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if any of these unlikely but serious side effects occur: swelling of the hands, ankles, or feet. A small number of people who take anticonvulsants for any condition, such as seizures, bipolar disorder, or pain, may experience depression, suicidal thoughts, attempts, or other mental/mood problems. Tell your doctor right away if you or your family caregiver notice any unusual sudden changes in your mood, thoughts, or behavior, including signs of depression, suicidal thoughts/attempts, thoughts about harming yourself. Get medical help right away if you have any serious side effects, including slow, shallow breathing. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of serious allergic reactions, including fever, swollen lymph nodes, rash, itching, swelling, especially of the face, tongue, throat, severe dizziness, trouble breathing. This is not a complete list. Oh my God. I'm going to repeat that. This is not a complete list of possible side effects. If you noticed other side effects not listed above, contact your doctor or pharmacist. Real safe drug. At least it's not addictive though, right? It's not an opiate, right? We'll find out. Uh-oh. It would appear there are withdrawal symptoms to gabapentin. Uh-oh. But I thought it was safe and not an opiate. And that means it's not addictive, right? I want you to know this is coming from the AmericanAddictionCenters.org. This is a reliable source. This is more reliable than WebMd. What are the withdrawal symptoms of gabapentin? Gabapentin is an anticonvulsant drug prescribed for seizures and nerve pain. People who develop physical dependence to gabapentin may experience withdrawal symptoms when they try to come off it. These symptoms can begin within 12 hours to 7 days after quitting the medication and last up to 10 days. Opiate withdrawals only last a week. Oh, fuck off. 10 days. Symptoms of gabapentin withdrawal may include nausea, dizziness, headaches, insomnia, anxiety. The fastest way to stop gabapentin is to taper off the medication under the supervision of a doctor. Even those who take gabapentin as prescribed may develop some physical dependence. However, those who misuse it or abuse it recreationally, why on earth would you use this recreationally? Really? Seriously? May experience significant levels of dependence and withdrawal symptoms when they try to quit or slow its use. Oh, so you don't even have to quit. All you got to do is slow your use or go down in milligram. There are documented cases of withdrawal symptoms in people who took daily doses between 400 milligrams to 800 milligrams for at least 3 weeks. The gabapentin withdrawal symptom may resemble some of the symptoms of alcohol and benzodiazepine withdrawal. This similarity may be due to the fact that gabapentin and these other substances all act on gamma-aminobutyric acid, or GABA, which is an inhibitory neurotransmitter in the brain. Oh my God, you're giving people a neurotransmitter in the brain. You know how opiates work. Opioids work. You actually have opiate receptors all over your body, in your organs, and in your brain. Opiates are actually a natural substance. This is not natural. You're playing with neurotransmitters in the brain. You wonder why. Like, we went over the side effects. You wonder why the side effects are the way they are? Right here. Right here. It plays with neurotransmitters in the fucking brain. Okay, anyway, we're trying to be objective, okay, not rude. The primary withdrawal symptoms associated with gabapentin use include anxiety, agitation, insomnia, fatigue, restlessness, irritability, dizziness, headache, sensitivity to light, sweating, irregular heartbeat, nausea, pain. That's a lot of side effects, or withdrawal effects. In addition, people who are taking gabapentin for seizures and suddenly stop taking it may experience a rebound in or increased frequency, oh my God, of seizure activity, including continuous uncontrollable seizures. Withdrawal usually occurs within 12 hours to 7 days after quitting the medication. Though a withdrawal timeline hasn't been clearly documented, some studies have noted symptoms that last up to 10 days. Factors that can affect withdrawal include age, dose, length of use, medical or mental health problems, concurrent use of other drugs or alcohol. In some cases, individuals who are at risk of or are already displaying severe withdrawal symptoms may require intensive inpatient monitoring and medical withdrawal management if complications arise. Experts recommend gradually smaller doses of gabapentin to safely and comfortably wean a person off the medication. Such tapering schedules commonly used with medications like gabapentin that have the potential to produce adverse withdrawal effects when being discontinued. Gabapentin use can be phased out over a period of 1 week, but the exact schedule will depend on the person's particular situation. Slower tapers may allow for a safer discontinuation of the drug. Experts recommend reducing the daily dose at a maximum rate of 300 milligrams every 4 days. And I might add, too, that this is one of the medications that you might have to take a drug to get off of this drug. Oh, because gabapentin is not an opiate and it's so safe to use and certainly wouldn't have any withdrawal symptoms, we have to go over some more withdrawal symptoms just so we can be intellectually honest from a different source material. This is from recovery.org. All right, so here's more withdrawal symptoms of gabapentin. Both those who abuse gabapentin, also known as Neurontin, and those who take it as prescribed can experience some of the withdrawal when the drug is stopped. Research shows that someone taking gabapentin for as little as 3 weeks, only 3 weeks, that's it, and at a dose as low as 400 milligrams a day may experience withdrawal. Gabapentin withdrawal symptoms are similar to those associated with benzodiazepine and alcohol withdrawal. By the way, alcohol withdrawals, like if you actually build up a chemical dependency to alcohol, is the only drug known to man where the withdrawals alone can kill you. So I'm really skeptical if a drug has the same withdrawal effects as alcohol. Just saying. Just a note. All right, so where were we? Oh, it even says that. And very far from mild to life-threatening. Oh, so, okay, gabapentin has life-threatening withdrawal symptoms. That's good to know. The symptoms of gabapentin withdrawal include irritability, anxiety, agitation, restlessness, excessive sweating, sensitivity to light, headache, confusion or disorientation, fever, hallucinations, rapid heart rate or heart palpitations, catatonia or inability to move, status epilepticus, a condition where seizures occur one after another, can be fatal. Good to know. Good to know. Real safe drug. I'm so glad that people are being prescribed this instead of opiates, right? Or opioids or opiates.
Now, just like before, I will give you, after hearing the side effects and withdrawal symptoms of gabapentin, I will give you first-hand accounts of people who have experienced gabapentin. Hopefully, this is starting to open your eyes.
Disappointed, taken for 1 to 6 months, March 28th, published March 28th, 2021. Not only did this medication, 600 milligram once a day, not before bed, not help my pain as much as hoped, but it actually caused other problems, like burning eyes, burning skin on my arms, legs, and face, blue fingernails, swollen hands and legs, pain on washing and drying hands, and wearing clothes that I have worn for years, and waking up with the spending all day with an intractable headache so bad I thought I was having a mini stroke, plus brain fog, walking instability, memory loss, feeling super cold. I finally realized that gabapentin must be behind all of this, and tapered to half on the advice of my provider. Been only 2 days off tapering, and many of the side effects, e.g. burning eyes, hand washing pain, dizziness, and headache have gone. Plus, my brain is so clear, something I haven't felt in the 2.5 months on this medication. Was told to do week to 10 days on 300 milligrams and then stop, which I will definitely do. Will never take this medication again. Genie, taken for less than 1 month, published January 13th of 2020. This drug has ruined my life. While it is meant to treat nerve pain, it had a paradoxical effect and caused nerve pain to spread over my entire body. 2 days after taking it, I have now had nerve pain in my eyes, face, ears, and entire body for 5 months. I am not the first patient to report this. Simply check out gabapentin groups on Facebook, and you'll see how many people's lives this drug has ruined. I am in pain 24/7 thanks to a drug meant to fix nerve pain. My doctors confirm they have seen this reaction in patients. Doctors, please stop prescribing this. I stopped the drug after 2 weeks, so it was not even a withdrawal. Yet I have heard the same story over and over. Patients develop full body nerve pain after several days on the drug that lasts months to years or more. Jude, published January 15th of 2020. I had a case of shingles on my head and face and was given 300 milligrams of gabapentin to take for the awful pain. It doesn't seem to help much, but the nerve pain down my arm and spinal injury that I'd had for a while was gone, so my doctor kept me on it. No more migraines, very little nerve pain, muscles less inflamed, and blood pressure down. I slept well, but feel very tired all the time. At 300 milligram dose, I was dizzy, stumbling, blurred vision, and nauseated. Gained 14 pounds, so I have dropped back to 100 milligram dose at night. I've been concerned about my driving because I do not feel as alert, and my response time is slow. What has been really frightening, however, is that I have stopped breathing during the night and wake up in complete panic. I'm scared and trying to step back my usage. Already, my shoulder muscles hurt, and the nerve pain down my arm and in my hand is coming back. By KF2332, taken for 6 months to 1 year, published December 26, 2020. Took this drug, gabapentin, for back pain related to a herniated disc. Was on the medication for 3 months at 900 milligrams per day, and took me 9 months to get off due to extreme withdrawal discontinuation symptoms. It's been really hard, and I wouldn't wish it on my worst enemies. Think before accepting a prescription for gabapentin. Lynn, published October 6, 2019. Yes, gabapentin works for pain. I took it for 6 years, but the withdrawal is worse physically and mentally than you could ever imagine, and doctors are beyond uneducated on this. There is a support group of over 4,000 people dealing with it. Gabapentin Neurotin Withdrawal Support. I wish every doctor and patient would read. We do not let animals suffer like this.
And now, finally, the question on everyone's mind. Here is the side effects and withdrawals of opiates/opioids. What are they? Dun 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 dun! Here you go. The side effects of opiates and opioid pain management treatment.
So here we go. Here we go with the opiates. What are the side effects of opiate or opioid medications? This has got to be good, right? Because, opiates are so bad. So bad for pain management treatment. Oh, just bad. So side effects include constipation, nausea, sedation, drowsiness, or clouded thinking. Basically, a sense of euphoria. Slow breathing. And might I add, the slow breathing is only if you take them in mass amounts. That's all they list? That can't be all right. Let's try to go for some other, citations. All right, so this is from WebMd.com. And one of the reasons, because opiates are so dangerous, opioids, your doctor needs to manage pain medication so closely as that they can cause side effects such as constipation, really not that big of a deal, drowsiness, it's not really that big of a deal, nausea, if you've ever taken an opiate or opioid, then that's not really that big of a deal. That's it. Some adverse reactions to other medications, some antidepressants and anxiety medications, particularly benzodiazepines such as alprazolam. I've never heard of that one. Ativan and clonazepam. Some antibiotics, sleeping pills, because they intensify the feeling of euphoria. So, okay. So that's the side effects of opiates. That's it. Itchiness is one of them too, by the way, but again, relatively mild. Okay, so then there's got to be a reason that they're so dangerous, right? I mean, let's look at the withdrawals. All right, this is opiate/opioid withdrawals symptoms from Line Plus.gov. So pretty reasonable citation. So this just goes over, opiates, opioids. So here's the withdrawals of opiates. They've got to be worse, right, than SSRIs, SSNRIs, and anticonvulsant medications. All the other alternatives to pain management therapy other than opiates. We can't possibly have opiates. They're so dangerous. Okay, so here we go. Early symptoms of withdrawal include agitation, anxiety, muscle aches, increased hearing, insomnia, runny nose, sweating, yawning. Late symptoms of withdrawal include abdominal cramping, diarrhea, dilated pupils, goosebumps, nausea, vomiting. That's it. That's it. That's literally it. That's it. And this is from MedlinePlus.gov. This is a government organization. That's it. Oh my God. And just to let you know, these symptoms only last like anywhere between like 3 days to a week. And you're more likely to have the diarrhea, the goosebumps, the possibly the vomiting, and that's it. There you go. Let's continue on, because we got to find out why opiates are just so bad. Dun 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 dun. What are the symptoms of opiate withdrawal? Let's find out. All right, so this one is a pretty reputable site as well. We've got the AmericanAddictionCenters.org again. It's not .gov, it's .org. And we have signs of opiate withdrawal. And I mean, they've just got to be bad, right? I mean, because the opiate epidemic says that opiates are bad, and we're resorting to SSRIs, SSNRIs, anticonvulsants, and even steroid injections, which I haven't even gone over. Maybe I'll save that one for a different video entirely. So here is the opiate withdrawal symptoms from the American Addiction Centers. nausea and vomiting, diarrhea, insomnia, anxiety, increased body temperature, racing heart, muscle and bone pain, sweating, chills, high blood pressure. In all this, I don't see anything about brain snaps or central nervous system damage that some of the other things we have covered cause. And as much as people like to say the alternatives are better, the alternatives are more addictive, have more side effects, and more withdrawal symptoms than that of opiates. So I really want you to ask yourself, looking at this through an objective lens, at the facts, the objective reality, the actual data on the table. Why is it that that an opiate or opioid regimen for pain management treatment is considered to be more dangerous than the alternatives that are being used, like the SSRIs, SNRIs, anticonvulsants, and steroids? Here it actually says, how long does the opiate withdrawal symptoms last? And remember, the withdrawal symptoms we did of the other drugs, some of them 6 freaking weeks, and some of the withdrawals can even cause death. Well, death is not on the list of withdrawals for opiates. That's interesting. So how long? Heroin and short-acting opioid withdrawal symptoms can typically be seen within the first 8 to 12 hours after last used, peaks within 1 to 3 days, and continues up to 7 days. Short-acting opioids such as morphine and immediate release formulations of the medication oxycodone, hydrocodone, and fentanyl will result in withdrawal symptoms within the first 8 to 24 hours after the last use. The withdrawal symptoms can continue up to 10 days. Seriously. The harder medications can last up to 14 days. But seriously, we're literally talking a withdrawal period between 3 to 10 days. Let that sink in. Listen to logic and reason, not fear, hype, paranoia that has been perpetuated by propaganda. And let me also tell you that the alternatives to opioid pain management treatment are more expensive than opioids. Opioids are cheap. Even if you don't have insurance, an opiate or opioid prescription, something like tramadol, Darvocet, hydrocodone, hydrocodone, could cost as little as between $10 to $5 without insurance. Some of the SSRIs, SNRIs, and anticonvulsants can cost up to $1,000 for a prescription without insurance. And then you have the steroid injections, which are about $400 an injection with insurance. So do you think maybe that has something to do with it? Just a thought. I really want people to think about this stuff. This is our healthcare just spiraling down the drain right in front of you. This is it. This is the opiate withdrawals that we're all terrified of. They won't even kill you. Yet some of the alternatives to opioids can kill you. The side effects can kill you. The withdrawals can kill you. Not opioids. So I find that extra interesting. I find that really interesting.
All right, after that being said, I just want to say that within the reviews of Gabapentin and Cymbalta, there were much more than just what I showed. One that I was looking for in particular that I read prior to recording this was an elderly woman who was in her 80s that was getting pain management treatment. Sorry, the cat wants to be involved. Say hello to everyone, Mama Smokey. Say hello. Okay, now go about your business. She was being treated for pain management, I think something to do with her hip. And she, again, reports the brain zaps. And, I mean, I had never heard of brain zaps until I looked up what, this side effect. Everybody kept reporting brain zaps. And now you know what that is. But this elderly woman that was taking Cymbalta, she experienced the diarrhea, the sleeplessness, the disconnect from reality, like being in a dreamlike state even though you're awake. She ended up going to her church so she wouldn't wake her husband up. And she said, "Thank goodness I'm retired, because I have no idea how anyone is expected to go to work under these conditions. And I'm glad that somebody brought that up. Because if the goal is for pain management treatment is that you can ultimately go and function like you used to, well, maybe it does something for the pain, the nerve pain, only the nerve pain. But the trade-off is that it makes you so mentally unstable that you cannot even function. So it negates the entire purpose in the first place. Think about why they're doing this. Think about what I said about the pharmaceutical company, or what you already know, you should already know about pharmaceutical companies. Think about what I said about the medical insurance companies. And don't take this lightly. This has been a nightmare for pain management treatment across the board. There is article after article after article about how the opiate epidemic is creating a massive headache for doctors and treating pain management therapy. Now, what I would suggest, I will cover in another video because this one has probably already gone on long enough. I hope that I have opened your eyes to some things and that you see that this is really problematic because, as I've said in a previous video, if the problem with opiates is that they are addictive, well, I've just demonstrated to you that not only are the alternative medications to pain management therapy, not only are they addictive, there's way more side effects. The side effects and the withdrawals are way more intense. They last longer. There's more effects to them for both side effects and withdrawal. They can actually kill you, not just an overdose. There's multiple testimonies of people having to go to the hospital because it's messed with them neurologically and made them physically ill somehow to where they've even ended up in the ER. So if the argument is that the reason why pain management therapy should not be done through opiates and opioids is because opiates and opioids are addictive, that negates the premise because the alternatives are just as, if not more, addictive and more dangerous. So then what's left? What is the argument? Is it that opiates have the tendency to be habit-forming because they produce a sense of euphoria instead of a sense of dysphoria? Because that's a pretty crappy argument. The fact of the matter is that the chemical compounds in the alternative treatments are not natural. It is not natural to play with the neuroreceptors in your body and in your brain. We have opiate receptors all over our body and including in our brain and in our organs. And opiates have been used for centuries to treat pain and still remain to be the most effective pain management treatment available to modern science. That's not to say that one day we won't develop something that is an adequate pain management treatment that is non-opiate or opioid. We have not gotten there yet. These alternative medications are not a suitable alternative. They are poison. And I can tell you from firsthand experience of being on SSRI and SSNRI, antipsychotic second generation tranquilizers, every single one of them is addictive, has a tremendous amount of side effects, and you will withdraw from them going off of them, and the withdrawals are really unpleasant. There's more withdrawal symptoms in every single one that I've been on than the withdrawal symptoms listed for opioids and opiates. This is a real problem. And I think that insurgency is needed. And I think the people and the doctors need to come together and say, you know what, screw what the insurance company says. This is more appropriate. Because the fact of the matter is there are people who cannot take the alternatives due to mood disorders. A lot of these medications will exacerbate mood disorders in people who have bipolar type 2, bipolar type 1, panic and anxiety disorder. It can bring on full-fledged psychosis and mania to the point where they cannot mentally function in the realm of society, nor even go to their job. I have a personal story behind that. I won't tell you that now. This video has probably already gone long enough. So, like, share, subscribe, comment, hit the bell button on any channel you're subscribed to, and support choices, not one's ability to impose one's will on others against their own will, such as if somebody doesn't want a chemical in their body, that should be respected. And if they're willing to take the risks of certain chemicals in their body, they have bodily autonomy. And that trumps over what the insurance company says, what Big Pharma says, and possibly even what the doctor says. It's my body. I think anyone should have the right to say what goes in their body and what doesn't. Thank you. Have a good night.